I'm Tisha. I'm the St. Martin student. I'm gonna do the IV start video. So first thing I would do is check the patient's chart and make sure that they don't have any allergies to the medication the doctor's ordered, and that I have the right order, and that I have the right patient, and that I know why the patient's getting it. So then I will gather my supplies, and I will come in the room, knock on the door, provide privacy. And I will wash my hands, don the gloves, and I will talk to the patient about what's happening. Hi, my name is Tisha. I'm going to start your IV because you have this in this room. The doctor wants you to start this medication, so we'll be starting your IV in your lower arm. Do you have a preference for an arm, anything that we should know, any allergies that I should know about? Okay, so it's okay to use this arm, and I think I see a vein that I'd like to use, so I'll go ahead and put the tourniquet on. 3 to 4 inches above the site. So I found the site I want to use. I'm going to palpate the radial vein. It's good. So I'm going to go ahead and loosen this. Then I will get my supplies ready. So I'm opening my packages. We're going to pretend that this was coming out of a new package. This is my flush. This is my ponytail, they call it. So I'll go ahead and take the lids off and connect the flush and make sure that it's running, and it is. And I don't have to clamp it, so I'll just leave it here on the table. Then I'll get my tape ready. And I'll have my bandage ready and write the date and time, the gauge size, and it's ready. Okay, so then I'm going to get ready to insert it. I'm going to take my gloves off, wash my hands, and put new gloves on. Oh, I forgot to clean the area, so I'll just go ahead and clean it now since I forgot. And I'll do it for 30 seconds, and I'll wait for it to dry. Okay, so now it's dry. I've already set up my supplies, so now we'll start the IV.
1 minute. We will not really do that. This
Go ahead and
ideally
put the
would have
tourniquet back on.
what do you call it? Safety. It doesn't, so immediately we'll go in there.
Grab my needle.
Anyway, I'm going to do that whole toe flush for a whole minute. Plant that off.
So with the bevel up, I'm gonna hold the skin taunt with my non-dominant hand, and we're gonna go into the vein 15, or 10 to 15 degrees.
And I'm going to give them a little bit of education.
So go in.
Number one, to be
I
careful.
think I feel give, so I'll drop it
Number two, to
in advance until I see
it's causing him too much discomfort, any redness, any swelling, anything just feels off to just let us know.
I think it's going in.
Taking this, I'll probably finish that too.
No, it's not going in.
And
So for the sake of the video, we're going to pretend that I'm starting all over again with a new needle.
good job, Fernando. All right, I'll get
Yeah.
you one start, or yours. I
So
can start.
you can help.
Antibiotics,
Okay. So I'll have the client give me a couple fists, make sure that we have
Well done, madame.
pronounced vein, and then I will pull the skin taut, and I'll try again with the bevel at 10 to 15 degrees.
I literally talked to him the whole time and they don't even notice they got pulled. Now we'll see what
Okay, now I see the blood return, so I'm going to hold the needle here with my hand and take the tourniquet off. And I'm going to advance the
Should I say that at the end, that I'm gonna go document?
catheter in, remove the needle, get rid of it.
Cameraman.
Yeah, my cameraman cut me off.
The Oscar speech was too long.
As long as you document, that's all.
Yeah.
Okay.
Oh, it does say documentation in DocuCare, okay.
And now I'm going to secure the line with my tape.
Do you know one
Yeah, if
time?
you wanna jump over here, someone might have to, is anybody done that can record?
Okay. Now I'm gonna flush the tube, draw back, let's see if I get blood return, then flush it for 3 mLs over the course of a minute. And after I've done that, and I got, and everything's working fine, I'll go ahead and secure the tubing with the bandage that I've already, dated with my name and the gauge. Okay, so there's that.
Does anybody need to do the pumps? Everybody's good?
Okay, and then we wanna put the label on the side so we can see for infiltration. Alright, then I'll secure this with my other piece of tape. Clamp it. Clamp it. Well, let me just flush it and then clamp it. Okay. And then I'll secure this tape.
Yep, no, I didn't do
And I'll get rid of everything. And I'll take my gloves off and wash my hands, and I'll talk to the patient, and I will give them education about any signs and symptoms of infiltration or redness, swelling, pain at the area to call us right away. And then I will go document.
Oh, well, it's only 2 points, I'm not really worried.